I'm Dr. Rajani. Let's go to the Ask Me question of the day. This is a lip filler one. I want you to hear this.
Hi, I had some lip fillers in my bottom lip. It was Volbella, and 4 months later, my lip was so swollen like a big balloon. The Volbella people said that it was probably because of a delayed reaction and possibly because I had the COVID vaccine. I had the COVID vaccine in October. This happened several months later, like months later. I was just wondering, have you heard of any other issues with facial fillers and the COVID vaccine? Thank you.
Okay, a lot to unpack here, but let's start with lip filler. Understand the first thing, you're adding a foreign body, a foreign substance to your body. So the body can reject it. It's why we go all natural first and as much as possible. 2 key points here, I guess 3. Number 1, she had Volbella, which is Vicross technology. Now, you remember she said, and the Volbella people said it was from the vaccine, or the Volbella people. The Volbella people are allergan. Really, they can't help you here. They can't say much. They make a medical device, which is a filler that we put in the lips. And I am going to cover general lumps and bumps at the end. But in this case, Vicross or Volbella can cause this problem months later, even if you don't get the vaccine. I've seen several cases. And there is some exclusivity to certain products on the market. So there are products that are less likely to cause this, and there are products that are more likely to cause this. In this case, you had Volbella, and I've seen myself in my practice several cases. One of the things, you guys all get your information from, a lot of people get their information from YouTube, and people, dermatologists, doctors, nurses, estheticians, everyone who you're hearing from, will talk about fillers, they'll talk about Sculptra, they'll talk about a PMMA or Bellafill, and they really have injected a few syringes. I'm giving you information from hundreds and thousands of patients, tens of thousands over the years, so I've seen it personally. There are protocols to deal with exactly that. We often call them DONS, or delayed onset nodules. Different from something called a biofilm, and different from something called a granuloma, and different from something which is clumping a product. Those are 4 general categories. And infection, I might add, for the 5th. So when people ask me questions here, it's very complex, but everything there points to a delayed onset nodule with Vicross technology. It can happen with any filler, to be clear, but some are more common than others, and there are protocols to deal with it. For me, all of mine have resolved with just dissolving with hyaluronidase, a dissolver. If you're getting cheap product or inexpensive product, someone might say, hey, you're getting Volbella, and actually, how would you know it's in the syringe? You don't. And there's a lot of impurities. So you go to dissolve it, the dissolver doesn't work because it probably is not Volbella. It could be something, what I call fake. No, we won't even go into that. That's a whole hour video, what is fake. But it could be a non-dissolvable product like silicone, like PMMA. Those are very cheap to get, and you never know what you're getting. And if the price seems very low, the probability you're getting something, I'll say, use the word fake, is very high. So the lower the price, the higher probability. In general, a filler, a vial lip filler, is going to cost you $800. That's about normal in the United States, maybe $600 in Canada, less overseas. Many reasons for that. Now, back to the COVID vaccine. I have 2 videos on this channel on the COVID vaccine and fillers. Absolutely, we see more reactions. I personally have seen more reactions immediately following the vaccine, especially within 2 to 4 weeks. I doubt that this case has anything to do with the vaccine, but it could. We're never going to know. I have seen what I believe are vaccine-related cases. There's just a little more inflammation in the body. There's a little more preponderance for your body to attack things, and this is a foreign body. So we have protocols. Your doctor, your physician, your provider nurse, esthetician, wherever you are, the laws are all different states as to who can inject this. We'll have different protocols that we use to get rid of these. But the first thing is differentiate it from, in this case, 3 months out, it could be a granuloma, it could be a delayed onset nodule, and it could be something we call biofilm. Very difficult things to deal with, but often the first line of treatment works. So lumps and bumps after filler are very common. There's immediate, there's somewhat delayed, which is 3 months, and you can have problems 3 years later. These things last in the body for way longer than you think, and that's why I say always consider all natural first, the less invasive the better, and then add things. I do hundreds and thousands of fillers a year. I do a lot of Sculptra. I treat people with PMMA. I have all of that stuff in my own face. So it's not like I'm doing things to people that I wouldn't do to me, but it's judicious use. It's consenting to people so they know what they're getting, and you have to be able to manage your complications. And that's a lot of the problems with the DIYers. It's great. I'm all for things you can do at home, but people do it yourself. A lot of people, you don't know what DIY means, but people who are doing things at home, probably part of the problem is if you can deal with your complications, great, and you're comfortable with it, there's nothing wrong with it. But if you're going to a provider and they don't know how to deal with the complications, you're going to the wrong provider. It's part of why you're paying more money. I charge a fair bit of money, but I also am providing a high level of service, expertise to my patients. It's just what I do. We all have our own type of practice. Very complex. I didn't want to take into such a deep dive, but you need to understand the complexities that we deal with. So when someone comes in with that kind of problem, though, that's some of what goes through my medical mind. There's a lot to it. Watch my 2 videos on the vaccine, and I did an update on it, and fillers. It will be revealing. That's the Ask Me of the day. Stay tuned. Ask me below. There's a link in the more info section below the video. Make it a great one.